And now I'm very excited to introduce to you our guest speaker, Sommer Gorn, from the Children's Hospital in Colorado. Sommer has been in clinical practice for over 21 years, and 15 of those have been dedicated to inborn errors of metabolism. She has obtained her undergraduate degree from the University of Florida and has participated in many peer-reviewed publications, clinical trials, and the development of patient-focused educational tools and programs. She is currently working with an international team of metabolic dietitians on nutrition guidelines in the management of epilepsy. She is passionate about educating and learning from others on the nutritional management of inborn errors of metabolism. And Sommer will introduce to us how she has used this product with 2 of her patients. I will just mention, however, that in the USA, this product is called PhenylAde, which you'll hear her refer to.
So now on to our second case. So this was a 20-year-old male, again with classic PKU. He was diagnosed via newborn screening at an outside hospital and came to our clinic at around 2 years of age. His highest known Phe level prior to the initiation of a Phe-restricted diet was 1,896.7 micromoles per liter, so significantly elevated. He was managed well throughout his life on a Phe-restricted diet without any difficulty. However, he was always considered a very picky eater, and even to this day, he is a picky eater. He had very selected food choices. He liked very certain special textures, didn't like a large variety. So it often made it difficult for us to get a lot of calories into him with foods based on his choices. So we relied heavily on medical formula for calories in addition to meeting his protein and other macronutrient needs. He also came to clinic for a routine checkup, and we noted significant increase in his physical activity since the prior visit. He was also complaining of stomach upset prior to or after drinking his formula and working out. So he just felt that the formula was very heavy on his stomach, a lot of volume on his stomach, and with his increased activity, it was becoming uncomfortable. So his activity included 2 to 3 hours of basketball 4 times per week, plus lifting and cardio exercises, specifically running, 1.5 to 2 hours every day. So the cardio was short, just a more 15-20-minute warm up, and the remaining part of his daily workout included weightlifting, and then the basketball was added in several times a week on top of that. His current formula was 38 ounces. Now, that is a large volume for a 21-year-old male. However, again, he used a lot of calories and he had high protein needs. And given his small choices in foods, we had always relied on his formula to really meet his needs. So we just started discussing options for lowering his formula volume, but we also wanted to give some options for increasing his protein intake to better support his activity days. In my experience, I have found that individuals with increased activity can sometimes have some instability of their blood phenylalanine levels. And so adding in more protein on the days of increased physical activity, whether that be a competitive sport or just consistent, intense exercise, I find that Phe levels, blood phenylalanine levels tend to stabilize, and our patients seem more satisfied and have better quality workouts when we support them better with protein in that physical activity. So if we look at what his prescription looked like prior to the PhenylAde GMP Mix-ins, he was getting a product called PhenX2, large amount of that was providing 74 grams of protein a day for him. He was getting Pro-Free for additional calories support, and he was getting about 525 milligrams of Phe from food, or roughly 10 grams of protein, intact protein. So He was getting appropriate protein, though I felt like he had room to get a little bit more on the higher physical activity days. However, the volume was really what we wanted to address and help bring that down and better support his GI upset while also supporting his protein. So we did several things in this prescription. We added the PhenylAde GMP drink mix, as well as some of the PhenylAde GMP mix-ins, kept the Phenex 2. He was sensitive to taste changes, so he wanted us to keep some Phenex 2 in there. With this initial change, we kept the Pro-Free in. So we did reduce his feed from food to account for the increase of phenylalanine from the GMP. So we were giving him another 60 milligrams of phe with the addition of these products. And so given that he was classic and that his levels were often could be unstable, not always sitting in our goal treatment range, we reduced his fee from food allowance, and he was okay with that as we made this change. However, we were able to reduce the volume of his formula and better address those difficulties he was having. So after introduction of the PhenylAde GMP mix-ins to this patient, we were able to reduce the formula by 6 ounces initially. Patient found that he was more able to be flexible with his formula intake. We are able to add additional PhenylAde GMP mix-ins for additional protein support on days that his physical activity increased it further, or if it was maybe a heavier weightlifting training day that day. He reported reduced stomach upset or GI upset with the reduction of the formula volume, and also improved tolerance with the addition of the PhenylAde GMP mix-ins prior to his activity. So no longer having that upset, heavy feeling in his stomach, taking this protein before his workout. We continue to make changes over time with him and reduce that Phenex 2 out of his formula eventually, and we're able to end up with a total volume of 20 ounces. So if you think to that back to the initial slide about his initial case, he was getting 38 ounces of formula when we first started this, and we are now down to 20 ounces of total volume, and his formula is comprised now of solely the PhenylAde GMP mix-ins and the PhenylAde GMP drink mix. So we've been able to change his formula and have good tolerance while also decreasing his total volume. His fee from food allowance, we increased back to his original 525. If you recall in the previous slide, we had reduced it initially when I introduced the GMP products. However, we found that his fee levels were remaining stable, and so I increased his fee from food allowance back up to the 525, and his blood phenylalanine levels remain stable. So in summary, we really enjoy working with the PhenylAde GMP mix-in products in our clinic. We have found that it allows reduction of formula volume when patients are struggling to complete their formula. It provides flexibility for formula intake. It improves satiety reported by patients. So several of our patients have said to us when they've introduced these GMP-based formulas, they feel more satisfied, more full. They don't get as hungry as quickly. Our patient did have, any of the patients we have, these two included, have introduced this product, have reported good GI tolerance with this when taken prior to activity. It's a good option for those who are increasing physical activity and need just some additional fee-reduced protein support. It's really great for our competitive athletes. In Colorado, where I live, there is a lot of hiking, a lot of skiing and backpacking, so the packets are great to throw in a backpack to support protein needs during those activities. Since the introduction of the GMP PhenylAde mix-ins, I do not typically reduce the fee from food allowance any longer. I did initially when introducing the product, as I was concerned I would see increased levels with the extra phenylalanine from the product. I will say now that typically I don't see big fluctuations in blood phenylalanine levels, and I haven't seen the need to reduce the fee from food allowance with the introduction of these products. So since the beginning, I do have changed my practice a little and no longer adjust their fee from food allowance with that introduction. Thank you so much.